Welcome to Gender-Based Medicine. My name is Estelle Hernandez, and today we will be discussing the complexities of sex and gender impacting healthcare professionals, such as those in the radiology department, the challenges and risk factors faced by healthcare professionals when trying to treat a patient who identifies with the opposite gender, the lack of gender-based prevention, management, and treatment negatively impacting care for males and females, and the importance of identifying new approaches to gender-based medical care benefiting patients of both sexes. To begin, we will start with the differences between gender and sex. To adequately address differences between the healthcare of males and females, it is essential to distinguish between sex and gender and how they affect health. Sex differences are based on biological factors such as reproductive organs and their functions, and concentration of sexual hormones such as testosterone and estrogen, and the effects of the X and Y chromosomes. Gender is associated with behavior, lifestyle, and life experience. Gender differences in healthcare include differences in preventative measures, prescription drugs, health insurance reimbursement, and referrals for or acceptance of surgical therapies. The influence of sex and gender in medicine is not easy to separate. For example, the sex hormone testosterone modifies behavior by causing aggressiveness, which is often associated with risk-taking and ignoring personal health. On the other hand, gender behavior can affect biological factors which affect health. For example, exposure to stress, environmental toxins, poor nutrition, or lifestyle choices can negatively impact male and female patients, and if the female is pregnant, it can also impact the fetus. Men and women's DNA repair are modified by their sex hormones, causing differences in the way they metabolize medications and the physiological effects it causes. Gender medicine should include biological and socio-cultural dimensions and their impact on women and men to improve health care. For instance, more research should be performed on osteoporosis and depression in men, while more data is needed on the women's urgent need for cardiovascular intervention. Another challenge in radiology is the obstacles faced by transgender patients. Transgender patients are those who identify with a gender that differs from those assigned to them at birth. Transgender individuals face numerous health disparities, including stigmatization and discrimination in the healthcare environment. Given these challenges, transgender patients may delay seeking medical attention for fear of experiencing negative treatment by healthcare professionals. Cultural competency training is essential in healthcare as radiologists, technologists, nurses, and radiology personnel are responsible for providing quality care to their patients regardless of race, religion, sexual orientation, gender identity, and other social classifications. The first point of contact of patients is made at the front desk. The front desk staff must be trained to handle situations where patients' legal names differ from their preferred names and gender identities. Asking a patient's preferred name and pronouns and having a two-step gender identification form, asking birth assigned, sex, and gender identification are ways to create a welcoming and safe environment for transgender patients. The radiologists, technologists, and nurses may encounter issues relating to the assumption of sexual orientation and gender conformity during imaging studies. While many transgender patients undergo hormonal or surgical interventions, the radiologists and technologists need to become familiar with the screening process before imaging studies. For example, it would still be essential to ask the last menstrual period of a transgender man, female to male, if they choose to keep their female reproductive organs. increasing the chances of pregnancy and exposing the fetus to ionizing radiation. Imaging studies using the contrast medium gadolinium should be limited because of the possibility of crossing the placenta and harming the fetus. Transgender women, male to female, who have their male reproductive organs maintain their risk of related pathological conditions and increase the risk of breast cancer due to hormonal therapy. Mammograms every 1 to 2 years at age 50 are recommended for those patients undergoing hormonal treatment. Also, ultrasound of the prostate and testicles are advised to check for cancers or tumors. In conclusion, while men and women are alike in many ways, biological and behavioral difference affect healthcare outcomes. Important risk factors such as sex and gender are not reflected in treating diseases affecting males and females. Instead of treating patients with the one-size-fits-all mentality, medical personnel and pharmaceutical companies must be educated in gender-based medicine prevention and develop treatments and disease management medications that will improve